Hi, I'm Anya Samek. I'm an associate professor at the Rady School of Management at UCSD, and I'm joined by my colleague Alex Wellsjo, who's an assistant professor also of economics and strategy at UCSD, to talk about her work on hand washing and cues. So, hi.
Hi.
I'd love to hear about how you actually, before we start talking about the hand washing, how you arrived at working in the area of behavioral economics.
So I've always been really interested in understanding human behavior and why people do the things that they do. So I actually started in undergrad as a cognitive science major. And then I started taking some econ classes, and I really liked that way of thinking. And then I took a behavioral economics class actually because it satisfied both of my majors at the time. And that's where I really became interested in behavioral econ as like a nice blend between the economics approach to thinking about how people solve problems and decide what to do, and the behavioral side of thinking more about the psychology and biases that people had. So I started working as an undergrad research assistant for a behavioral economist, and that's how I got a lot of experience in what research was really like and got interested in working in the field.
That sounds about how I got involved as well. I think trying to understand human behavior is really fascinating. So today we're going to talk about your paper, which is called Simple Actions, Complex Habits, Lessons from Hospital Hand Hygiene. So the idea for this paper is that there are these routine tasks that are critical to performance but aren't consistently done. And specifically in a hospital setting, you're finding that hospital hand hygiene or washing your hands, which are vital for preventing infections, these guidelines to wash your hands are actually followed only half the time. So, can you tell me more about how you started working on that project and if you were surprised by that result?
Yeah, I was. So I've been interested more generally in performance in the workplace, and specifically in health settings where, we're not just making something in a factory and care about the output, but also the output of performance in those workplaces have real consequences for real patients. And so this was a setting I thought was really interesting because it's a pretty easy task to do. All you have, so providers are supposed to wash their hands every time they go in and out of a patient room. So it adds up to a lot of times, maybe like 50 to 60 times a shift that they're supposed to be doing this in hospitals. But it's pretty easy to do as far as the types of things that nurses and doctors are asked for. And yet we see, like you said, compliance with these hospital guidelines is typically around 50%. And it's not because people don't think hand hygiene is necessarily important. We know it's one of the best tools we have to prevent healthcare associated infections, which affect millions of patients and cost billions of dollars each year. So I was interested in trying to understand why we still have this problem despite knowing the benefits of hand hygiene. We really haven't come up with a great solution for how to get people to comply with those guidelines more often. And so I was interested in understanding kind of why behavior change in this space was so difficult.
And what are the kind of the main mechanisms that we think that are causing people to not wash their hands? Like, what are the main behavioral reasons?
So I think from my perspective, that one of the main behavioral reasons is just that people are forgetting to do it. So just anecdotally in talking to nurses and doctors, the first thing people will say is, I wash my hands 100% of the time. And I can tell you, looking at more than 10,000 people in the data, nobody's washing their hands 100% of the time. Very few are even washing their hands 90% of the time. And so I think people, in many cases, I think it's not that people are choosing not to do it in this way we typically think of in like a utility maximizing framework where you have your costs of hand washing, your benefits of hand washing, and the kind of standard econ mechanism would say the costs are higher than the benefits, so people are choosing not to do it. And for me, at least in talking to people, that's just not what people are describing as their experience. It sounds like in many cases, they mean to do it and they're just forgetting. There's of course some exceptions where say their hands are full and they can't do it, but I think that's not the norm.
So this is actually a really good example of what I talk about in my class in behavioral economics is this idea that people have intentions, but then don't follow through, or people have a belief that this is something that should be done, but then somehow don't follow through. And the idea here is that behavioral nudges are particularly good at addressing problems like this because we're moving behavior in line with intentions. So, what kinds of interventions had you thought about doing that might address this problem?
Yeah, so I think the kind of standard interventions that are tried and have been largely not very successful are things that are trying to get people to wash their hands through like incentive programs where they're, say, going to win a pizza party, or we're going to talk a lot about hand hygiene. And that's really trying to change people's like paying attention to hand hygiene, which I think works in the short term, but doesn't seem to have the long run effects. And so what I've studied in my research is how their behavior matches models of these cue-based habits. And that can give us some different insights into interventions that maybe try to build more on how we can change cues in the environments to actually get people to change their behavior without changing their intentions. If the intentions are already there, there's kind of something else that's lacking. So we could talk a little bit more about that, but trying to change the environment so it's easier to build habits or easier to port habits across different settings is potentially a more effective way than just trying to motivate people to wash their hands more.
So that's an interesting point is that there might be some interventions that work on intentions and some that work on behavior. And it's not necessarily that if the problem is not intentions, you shouldn't be providing the education. You should be thinking about something else. What kind of cue are you thinking about to get people to wash their hands?
So one of the things I see in the data is evidence of physical cues in the environment. So the data that I have looks at whether doctors and nurses are washing their hands each time they go in and out of a patient room. So I know the location very precisely down to the specific room where they're washing their hands. And in these
I want to
cue-based
step back
models,
though. Tell me about the hospital you worked with and how you even have that data. That seems like crazy
yeah,
amount of data to be able to collect.
so this data comes from a company that developed an electronic monitoring technology. So they actually work with many hospitals around the country. So I use data from about 30 of those hospitals. And so they developed this system for tracking with essentially an RFID location tracking system in the hospital. So you get credit as a healthcare worker for using hand sanitizer or soap dispenser within this 30-second window of entry and exit from a patient room. So the data actually comes from that company. And so I can track people across different rooms in the hospital, different departments, and see when they're washing their hands and where.
And so hospitals are actually using this to monitor the hand washing.
Yes, so
Mhm.
hospitals have incentives, in particular, if they've had a string of healthcare associated infections, they might become much more interested in trying to do something about their hand hygiene compliance. And so, one of the ways that they can try to do that and get credit from the accrediting body is to actually track hand hygiene in a better way. The kind of standard way is to have people standing with a clipboard and checking what people are doing. And those kinds of reports tend to show very high compliance, like 100% compliance. And then when you implement these monitoring technologies, it shows that compliance is much lower. And so then they know kind of really what are the problems that they're trying to face, and they can have at least a handle on whether or not they're addressing them.
And so they've got not only an incentive to reduce, they've got a monetary incentive as well, in addition to kind of an ethical incentive, these hospitals.
Yes, so hospitals can be essentially fined if they have too many of these healthcare associated infections. And the accrediting body, the Joint Commission, who will come and visit the hospital, is also watching for whether they're compliant with the hospital guidelines for hand hygiene. So if you observe evidence of noncompliance, that's a factor against them.
Okay, and so they're doing, they're already trying different types of interventions. Like you said, they might be trying the education or the pizza parties that haven't been super successful. And so let's get back to now the physical cues. So what's that physical cue look like?
So I don't know exactly what the physical cues are. So all I see in the data is these, basically room identifiers. But having visited some hospitals, I can tell you if you walk into, say, one room, the hand sanitizer dispenser will be on the left of the door, and another, it might be the right. And it's things like this that we think might be contributing to the context or the cue that's going to trigger you to do a habit. So you walk into a room, you kind of reach out and use the sanitizer dispenser because you've been in that room 100 times before and you know exactly where it is. And you just kind of do it automatically without thinking. On the other hand, if you're walking now into a room that maybe has a different layout and looks very different than the type of room you typically go into, you might not have that automatic reflex to wash your hands that you would in a place you're more familiar with. So I can't say exactly what it is about the environment that's causing, triggering hand washing in one setting, but not in the other. But we can see in the data that rooms that you visited more in the past, you're more likely to wash your hands there in the future.
And so that's your evidence for the cue based, that it's cue based because of the familiarity of the room. And potentially that says something about the location of the hand sanitizer. When you come
Yeah,
to
so
a new room,
that's
you
the
don't see it.
primary evidence, and
Mhm.
then I also find that the kind of people react differently to that. So what I do in the analysis of the data is try to think about people who are relying more on these automatic habits and people who are relying more on their kind of intention and maybe hand washing more intentionally. And so for those people, what you see is, say, as the costs of hand washing increase, for example, as they're tired over the course of their shift, their compliance falls. But for these people who I think are operating out of habit, in that case, it's become an automatic behavior. It's no longer a cost-benefit trade-off, according to the neuropsych models of habits. So you're no longer doing this trade-off. And so even as the costs of hand washing increase over the course of your shift, those people keep washing throughout the day, whereas the people who kind of are doing it more intentionally get tired and stop washing their hands. And then when you do see them kind of moving to a different physical environment, that should affect the habit people just as much as the non-habit people. And that's exactly what I find. So if anything, they respond a little bit more to, say, changing location than to people who are washing more intentionally.
That's really interesting. So it's not the case that cues work for everyone, that
Um,
or that cues work for different people at different kind of strengths.
Yeah, so I can't say exactly what causes someone to become a high complier and look more habit-based than someone else. That's something I'm hoping to do in future work. But at least I see that, say, exposure to a place makes that tends to develop habits in that place. And then when you move to another location, those habits aren't necessarily ported over.
That's really interesting. And so this cue habit kind of formation model comes from psychology, I saw that you wrote about.
Yeah, both neuroscience and psychology talk a lot about habits in this way.
Okay. And what other kinds of cues have been studied beyond this one in just generally in psychology?
That's a great question. So I think we don't really have a great sense of what cues are. So there's a lot of candidate cues. Physical location is one that's been studied in different ways. So I mentioned, say, the dispenser being to the left or right of the door. That's kind of how one of the examples I'm thinking of. Others have been like the what kind of setting you're in. So say like a movie theater versus a boardroom. You might have different habits in those different settings or different locations. So if you think about people moving as an example of when we see habits often break. So even if you had a really strong habit in one place, if you move to a new apartment, you might behave differently. And other types of cues that have been discussed are things like your emotional state, or even kind of how you're feeling. And so I think there's a really wide range. We don't know exactly what are cues that trigger habits or not. It could even be other behaviors. For example, if you always kind of wash your face and then brush your teeth, washing your face could actually be a cue that triggers you to brush your teeth. So it could even be kind of a sequence of actions.
That's interesting. And so I've read some of these kind of how-to articles, which are not, I don't know how scientific they are, but they say things like if you want to start going to the gym, you should put your gym shoes out right by the door where you can see them because that's going to kind of be a cue for you to go to the gym. What do you think about those types of recommendations if you've heard of them?
Yeah, I think that makes sense. I think the more you can make things automatic and the less you can the more you can kind of set yourself up to build this automatic path towards doing the behavior you want, the easier it will be to form a habit. And especially if you could stack habits in this way, where you kind of have one good habit that you do, try to add something onto it so that you continue to build. Kind of trying to make your own cues I think it's a really good idea in practice. We've seen some evidence that maybe it's a little bit harder to do that than we thought. So there's a paper I like where they try to get people to go to the gym and they try to get them to go kind of at a similar time each day to try to build more consistent habit than, say, just incentivizing people to go to the gym more generally. And so a lot of people thought that it would be more effective to incentivize people in this kind of narrow time window to help them build a stronger habit. In practice, people liked the flexibility more, I think, and it didn't really work out that way. So I think we still haven't quite nailed how to use cues to build habit, but I think the idea is right, and we just need to figure out a little bit of a better way to leverage cues to build good habits.
So that's interesting. So there's this experiment where we think that cueing someone to go to the gym at a specific time should be very effective, and they find that it's actually not. And it brings me to this point that experiments are really important for testing different interventions and different theories. And so I know what you have here is just a set of really interesting data set, but like you said, you don't have an experiment there. You just have in some rooms, people are washing hands more than others, and there's some theories. So I'd love to brainstorm with you what your ideal experiment in a hospital might look like to try to test interventions for these cues.
Yeah, so I've thought a lot about this. I think one of the things that I'm most excited about hopefully doing is to try to just standardize the room layouts. So I think it's much more, in a lot of ways, hospitals are trying to standardize already. That's kind of a best practice, but it's often hard to do. And there's, I think, tension between kind of the people who are involved in the design of the hospital, say the interior decorators, and people who are interested in, say, building habits to prevent infections. So logistically, it's challenging, but I think there's also so thinking about kind of what is, like you asked about, what is it about the physical space, or what are the cues? So one candidate would be, if it's to the left or right of the door, and so maybe you want to have it so that the hand sanitizer is in the same place every time. So for example, I visited one hospital where there was a nursing station, there's a sink, they have soap, sanitizer, and lotion. So they have three dispensers. And you go to one nursing station and it's kind of soap, sanitizer, dispenser, or lotion all in a row. You go to another one and it's lotions over here, soaps over here, sanitizers over here. So something as simple as just reorganizing those so they're in the same place every time, so you can kind of have that automatic response, I think would make it a lot easier to kind of port your habits across different locations.
And this is really interesting because it also is a very simple. I think that changing room layouts might be tricky, but changing where you place the dispenser and which dispenser you have in which order, the soap or the lotion, seems like a pretty low cost fix that could potentially save a lot of lives or reduce a lot of infections.
Yeah, I think so. I would love to test it and see if that's the case. But I mean, the nice thing is I think it's just something people haven't given a lot of thought to. And you think, you can look around and figure out which one's the soap and which one's the lotion, but just it's one less thing that people have to think about. I think that actually matters, especially in these contexts where people are really overburdened and work long hours. Just the more you can take out of a thought process, the better.
That's really interesting. I talk a lot in the class about defaults and how defaults are really powerful and simplification and how simplifying processes is really powerful. And I see these cues as being kind of in between these two things. Like it's this default habit that you take because you see a cue, and the cue is very simple in figuring out where to place the dispenser. What do you think? So I've taught before a class on experimental economics where students have to come up with different interventions to encourage healthier habits and or healthier behaviors. We don't specifically focus on habits, and much of what they do is post signage. So they'll post signage that says no smoking here, or UCSD says no smoking here, and then they'll observe if people are smoking in that area, or clean your gym equipment, and then they'll look to see if people are cleaning their gym equipment. Do you think signage in addition to the cues would be helpful, or do you see the cues as kind of having a much more long-term effect and the signage being something that over time people will ignore?
Yeah, so there has been studies of signage to try to get people to wash their hands more. It seems to be effective in the in the short term. So I think, like you're saying, it's something that initially they pay attention to, and I think that's because if you walk into a room every day and all of a sudden there's a sign there that says "wash your hands," you pay attention to that. But then, you see it a bunch of times, and it just kind of becomes part of the background. And so those studies have shown, if anything, really short-term effects. And so I think I see these cues as something like if you can build this automatic response to a cue, that could sustain your behavior change in the long run more so than these kind of shorter term attention grabbing interventions.
That's really interesting. I think we know a bit more about what works in the short term, and I think that's partly because a lot of grant funding that university professors have is just very short term, like go test this one time, but we don't have years of follow-up. And so trying to test long-term effects of interventions is itself important and challenging. But thinking about which interventions actually work in the long term is a separate question and very important. And so it sounds like these cues, as long as you don't change the environment, kind of having the cue be consistent over time could be a long term, could even actually increase the compliance over time because as you kind of form the habit, you could see stronger effects. That's a very cool kind of aspect of this type of behavioral intervention that you don't see with a lot of things like the signage or the incentives.
Yeah, absolutely. I think it would be great to test that.
Well, thank you so much for talking to me about this project. It's really interesting and really neat. We'll look into kind of hospital hand hygiene and cues. I really appreciate your time.
Thank you. Bye.
Bye.